Hi, my name's Andy Reddick. I'm an emergency medicine consultant and I'm the Clinical Services Director for Winter Planning for NHS Tayside. Winter is normally a very busy time in the NHS, and with the added disruption and uncertainty of the COVID pandemic, we're expecting this winter to be even more complicated and difficult to manage. As a result, we have a dedicated winter team which is planning the response to the winter pressures and is building on all the good work that's been done over the last few years by the previous teams. In NHS Tayside, we use a heat map to inform us of the problems we're having within the system, both in the hospital, in primary care, and with the health and social care partnerships. These heat maps are used by our command and control structure to decide on responses early and try and essentially nip problems in the bud and try and keep our services running to give the best benefit to everyone in our area. We have various initiatives in place which help us to prevent problems building up in the system, and these include our flow navigation centre, where we will manage calls coming from NHS 24, and a dedicated team of emergency medicine clinicians will try and guide patients towards the most appropriate service for them. It's important that people do use services appropriately and don't just turn up at GP surgeries and emergency departments when other services will do a better job for them, ensuring those services are available for all of the public to use. It's important over the winter that we look after ourselves and we look after others, and people should make sure that their medicine cabinets are stocked up with simple supplies like paracetamol and ibuprofen, and that people do use pharmacies and other community services for some medical advice. As well as the usual winter problems we have, the COVID pandemic is still ongoing, and it is important that when people are given the offer of vaccinations or booster vaccinations, they take those offers up, and that we continue to follow the advice we're given on social distancing, hand washing, avoiding socialising unnecessarily with groups who we don't know, and also things like opening windows when we're indoors in large groups to help the flow of air and help prevent transmission of infection. Wearing masks in public places is still in force in Scotland, and again it's important that we do this to help prevent that transmission of COVID from people who are unaware they have it. In short, we are as prepared as we can be for this winter, and I hope that you will all do your part and contribute to the health of everyone in our area.